Hello and thank you for joining this seminar. My name is Emiliano Grossi. I'm a physical therapist since the year 2000 in Rome, Italy, and from 2004 I'm in the teaching staff of RPG Souchard method. In the next hour, I will give you an overview on RPG method as an introduction to it. So I hope you will enjoy it. RPG stands for Global Postural Reeducation. So, in English-speaking countries, we can refer to it with G.P.R or RPG indifferently. G.P.R was born more than 36 years ago. In fact, in 1980 was released the first book of Professor Souchard in France, and is now taught in more than 18 countries in the world, with more than 22,000 physical therapists actually formed. But we have to say that despite the numbers of books written by Professor Souchard, the lack of translation of them in English has historically determined the method to be less known in English-speaking countries, until around about 4 or 5 years ago, when, as the scientific evidences and clinical studies become to be more represented, in fact now we have about 75 publications and several are RCT, and so we can say that the interest around this method is growing a lot in the past years. So let me give you an overview on RPG method. RPG started with studying the relationship between two different groups of alteration we can find in our patient, and we can divide them into big groups. We can have microscopic alterations, most of them are articular, let's say joint alteration, and macroscopic deformities, the one related to postural alteration. But most of all, RPG started to study what are the relationships between those two alterations, the relationship between articular alterations and postural alteration. So how do they organize one to each other? To simplify the conclusion of these studies, we can say that postural alteration can determine and lead to articular, let's say, joint of axis work. And with the same concept, we can imagine that bad axis joint function can lead to pain and easily to posterior adaptations. So we can understand that there is a both-way relationship between those two kind of alterations. And the idea after that was, if it's true that those two are related, organizing themselves in a coordinated way in pathology, can we treat them together? Or even better, can we treat them simultaneously together to solve the cause and the consequences of an alteration at the same time? So to do that, we need a specific assessment and a way we can identify the structures that are involved in developing this kind of coordinated alterations. And if we can find those structures, can we rebalance the tensions and tone between these, let's call them winners and loser structures, by eliminating the asymmetric traction that has as an ultimate effect the macroscopic structural modification, so postural modification? To achieve a postural balance and allow its maintain, we use exercises that are called therapeutic postures. And therapeutic posture permits us micro adjustments because, as I told you, we must work the joint alteration, so the microscopic alteration, together and simultaneously, if possible, with postural alteration. So therapeutic posture permits us to do that with a constant active work that we'll see later, and this leads us to a more durable balance. So global postural reeducation has been also defined a proprioceptive active method that uses some instruments, for example, the inverse myothetic reflex that we'll see also later. So when people ask me if G.P.R is a more orthopedic method, more a neurologic or neuromuscular method, I like to say that it's a neuromechanic approach. So let's start this overview on what are the kind of problems that RPG can face, so we can see later on how they can be treated, and I can show you at the end of this presentation some case results. So RPG may have a role on problems that are mainly connected to altered biomechanics. So among these we find, for example, structural problems of deviation of the spine like hyperlordosis, hyperkyphosis, and scoliosis. Also peripheral deviation, so imagine for example a valgum of a knee that is correlated with an internal rotation of the femur. That's a biomechanical alteration we can face. Also problems that come from articular lesions, so bad positioning of one or more joint surface in comparison with the other. But also, and this is very important, articular hyperpression that we call crushing, so a pressure that goes not only in a simple joint, but for example between two vertebrae. So we call it intervertebral hyperpression, and that can cause every kind of, for example, discopathy, from a degeneration of a disc until a discal hernia. We can treat them in different tracts, cervical, dorsal, lumbar tract, of course. RPG also has a very good effect on all the respiratory problems that are related to unaltered mechanics. And if the altered mechanic is a cause, we have an excellent role of respiratory problem. But when respiratory problem come as a secondary problem, for example, for a bronchopathy, obstructive pulmonary disease, or even pulmonary fibrosis, we can treat this alteration as, of course, a secondary effect with RPG. And one of the best probably quality of RPG is that can be used very early in post-traumatic and post-surgical problem. So I mean we can treat acute problem that give us the possibility to treat patient without having to wait days or weeks for them to be, for example, in bed waiting for the anti-inflammatory or cortisone to have effect. So we work very in a strict relation with doctors, and we coordinate ourselves because they know that we can treat those patients very early. And this is very good quality and comes from the way of application of RPG, which is slow and progressive. So RPG also has a role on sport-related problems that must be considered as an action of pathology related to the sport, but also as an increase of sport performance. For example, the national team of volleyball of Brazil, of female volleyball in Brazil, is treated constantly with G.P.R. The soccer male national team also. There are a bunch of professional teams here in Europe, in Belgium, in France, that are treated with G.P.R. once or twice a week because they have seen that there is a reduction, so a decrease of sport injuries and sometimes an increase of sport performance. So finally, also RPG has a role on some neurological pathology, especially the one related with hypertonia. So there is always in this case a neuromuscular alteration. So even if in this case we cannot treat the cause, so the damage in the brain, and there are a lot of other techniques that can do that very well, but we can modulate the muscle tone. So the result of an hypertonia pathology or a spastic pathology goes to the muscles. So we can treat that kind of alteration, for example. So to recap so far, we can say that we point to a simultaneous treatment of microscopic and macroscopic, so postural alteration. So to treat possibly cause and consequences, if they are related, we have to treat them together and simultaneously. We also have an instrument that I'll describe later on that gives us the possibility to treat acute problems. We always aim to an active work to rebalance structure. So let's see now some important concept that leads to this approach and to the treatment of G.P.R method. The first achievement of RPG was to study the static function. So the G.P.R started is traveling defining the differences between two muscular functions, the dynamic function and the static function. So historically we are very familiar to the dynamic function of a muscle. Is the one that we find in every anatomy book. So we know every movement that a muscle does in our body. But the static function of a muscle, especially in 1980, was very difficult to get. And Professor Souchard deeply studied that because we started to know that there are different anatomy in different muscles. But what are the functions of these different muscles? Case is this one of this boy. This is an 8 years old boy complaining since 3 months a lumbar pain. This is an example of an adult treatment. So adults with a lumbar pain, a side shift, where a MRI showed a L4, L5 hernia. And this is another case of an adult patient with a discal hernia. So just to show you other kind of alteration we can treat, so not only postural as we saw in little kids, for example, and I show you in the previous slides, not only articular or spinal or of decompression as discal hernias as we already saw in other slides, but in actually any case that there is the presence of tensions alteration of a lot of fiber structures. Thank you for your attention, and please note that you just seen a demo of an RPG Souchard method presentation. If you're interested to know more about it, please use my references provided here. Bye.